Good evening and welcome to the Healthy Debate. My name is Lindy Naughton. Our aim with this programme, produced by Health Freedom Ireland in conjunction with the Irish Inquiry, is to promote a healthy debate on issues relating to health in this country. Much of the material you will see on this channel is not available in the mainstream media. So if you want to support us in any way, we'll have the details at the end of this programme. We'd also like this week to put out a special appeal for studio space. Where we are at the moment is in a hotel. We were very lucky with the first 6 programmes that we had a studio, but if anybody has space where we could put up a studio that we can keep 7 days a week, please message us in the, I think in the comments. Am I right there, folks? Yeah. So you can message us through the comments or through Facebook indeed. You know, the name of this is the health debate, but at the moment it's the COVID-19, or as I like to call it, World War C. And this week we're turning our attention to the contentious subject of vaccines. As we all know, the vaccines are now available in Ireland. I don't quite know how many different kinds. Whether people are taking them because they think they're a good thing or because they think they're a magic bullet that will get us out of the horror show we're all living through at the moment is open to argument. It's very difficult to know. We're fortunate to have 3 guests this evening. We have Martin Mullen, who's from an ex-pharma worker. We have Dr. Marcus de Bruin, who probably most of you know, we can describe him as an ex-GP at this stage. And we have a nurse called Ellie, who's going to remain anonymous, so you'll see her behind a gauzy screen because she doesn't want to be identified because she may well lose her job for the views she will be expressing in this programme. So we'll start off by just getting each of our guests to give a brief account of who they are and what they're doing. So we'll start with you, Ellie, if you're right. Ellie?
Okay. Hello, my name is Ellie. I set up Frontline Freedom so we could support primarily healthcare staff with their right to medical freedom and bodily autonomy, as we knew the healthcare staff would be first in line for the COVID-19 vaccine. As healthcare professionals, some people are very, very willing to take the vaccine and some are certainly not willing to take the vaccine. As a nurse of 22 years, I'm certainly not willing to take the vaccine, and I also have the view that I cannot vaccinate anybody against COVID-19 as I don't have enough knowledge about what's in the vaccine or what the side effects are going to be. And as a nurse, nurses primarily are advocates. They advocate for their patients, and health promotion is a big part of our job. I can't say the vaccine is incorrect. I can't say it's right. However, what I can say is I cannot promote a vaccine that we don't know enough information about.
Okay, right. So Martin, can you give us your credentials, please, and what you'll be speaking about?
Well, in a general sense, I'm interested in the topic. I joined the pharmaceutical industry in 1989. I worked for 3 of the blue chip companies, Glaxo, Pfizer, and Sanofi. For about 25 years, I worked in various areas of medicine, so therapeutic areas including respiratory conditions, cardiology, rheumatology, and neurology, urology, nearly everything essentially over the years. The thing that I'm quite interested in this debate is the importance that choice has in the debate. And it seems as if the agenda is to curtail choice and that you don't have a choice. And they're trying to browbeat people into actually acquiescing to what they're looking at now. The other thing that I would like to stress is as well, I look at health after being involved in the pharmaceutical industry for many years. My perspective on healthcare and healthcare delivery is more of a holistic concept. I mean, I was even listening to the radio come down tonight, and I was listening to a song by the Beastie Boys, and the guys are saying, you know, we fought for the right to have a party, right? So, you know, where is the fun in life now? happiness, I've actually studied happiness as a coach, so I'm actually a professional coach. And I look at happiness, and no one's talking about happiness and how people achieve some form of satisfaction in life, and that is integral to people's well-being. Right. So all that seems to be happening at the moment is talking about a vaccine and a virus, and I think it's quite ludicrous to control a virus as a utopian objective.
Okay.
That's my perspective.
Grant. And Marcus, what have you been up to this week? Are you there, Marcus?
Well, I'm still a practicing GP.
Have you learned anything
Lindy,
yet?
I haven't entirely thrown the towel in as of yet. I have finished with my HSE contract, so I'm no longer contracted by the HSE, or I won't be contracted by the HSE from the 15th of this month, which is this Friday, which will be my last day as a contracted GP. But I'm still a general practitioner, and I would hope to be a general practitioner for the remainder of my working life, just not working for the HSE. Yeah, my own, that's my own background. I have to say at the outset that I'm currently the subject of a medical council investigation for speaking out against the guidelines and against the narrative and against kind of mask wearing and various policies that have been introduced by the government. So I have to be very clear in stating at the outset here that I do not speak on behalf of Irish general practice, and I do not speak on behalf of all doctors in Ireland. There are many who agree with me, but there are many, many more, perhaps the vast majority, who would disagree with me. But there are certainly many who would agree with some of my opinions. So I would have to state that at the outset that I speak for myself and offer my own opinions rather than those of Irish general practice or that. But yeah, my own background is I was a microbiologist before I became a medical practitioner. I qualified in microbiology at Trinity College Dublin, and after that I started a master's degree in public health, but finished that early to study medicine at the College of Surgeons, after which I trained as a general practitioner in New Zealand, and I've been working as a sole practitioner in my own clinic in North Dublin for the past 10 years. And up until last year, I was a sitting member of the Medical Council, but I resigned from the Irish Medical Council as a consequence of how elderly residents of nursing homes were being treated during the crisis. So
Marcus,
that's my background.
Marcus, we spoke about the nursing homes crisis. Could you summarise, I think you might be the best of the three, to summarise exactly what the position with vaccines is at the moment. When did they start, vaccinating people? And how many medical professionals are being vaccinated? Here's another one. What vaccines are being used? So what vaccines are being used? What's going on with the programme at the moment? Could you tell us that?
Well, I'm probably not the best person to ask about that, because one of the reasons I resigned my HSE contract is because I didn't want to be involved in the vaccine programme. I don't want to take the vaccine, and I certainly would not administer the vaccine. I wouldn't be administering it to young, healthy people who are at no risk from COVID-19. I think this is probably one of the first times in the history of human medicine that we're having large-scale vaccination programs and vaccinating people who are at no risk for a particular disease. So I haven't, to be honest, been too involved in the vaccine program, and so as far as I'm aware, it's been up and running now for the past couple of weeks. It's a Pfizer vaccine. It contains it's a messenger RNA or an RNA vaccine. It contains a piece of genetic material that stimulates an immune response, and it's hoped that once people become exposed to coronavirus, that the usual mechanisms of a vaccine working, and that it recognizing the vaccine and recognizing then the infection very early and stimulating an early immune response. It's hoped that the usual kind of mechanisms for vaccine efficacy will take place. But it's
a new technique. I got a quote. I got a quote from something today, I can't remember. mRNA, we're told it's something different. And I got this line, I wonder if you could explain it. Animal trials in animal mRNA vax led to pathogenic priming. What does that mean?
Yeah.
Sounds alarming.
Well, I suppose it's very complicated to try and get into what mRNA and the different types of vaccines. I suppose, to be simple, generally speaking, most vaccines are made of pieces of a vaccine. So the shell or outside coat of a vaccine usually is made up of proteins or glycoproteins, proteins with pieces of sugar on them, and they're the usual subunits or pieces of the vaccine that are injected into people. So they're the surface of the vaccine. Inside the vaccine, there's genetic, or inside the virus as such, any virus, there's genetic material. And so the vaccine that we're taking at the moment contains the internal genetic code of the virus. That's what's being injected into people. So that's a piece of messenger RNA. So what messenger RNA exactly is that when inside all of our cells, in the nucleus of all of our cells, we all have DNA. So DNA is unwound when the body or when the cell itself needs a particular protein or needs something that's coded for in our DNA. The DNA unwinds, and there's a little copy of that piece of DNA called messenger RNA. And that messenger RNA exits the nucleus of the cell into the cytoplasm of the cell, and that messenger RNA then is translated by ribosomes inside the cell, and those ribosomes translate the messenger RNA and make or manufacture the protein or the product, whatever it is that the cell requires. So that's the kind of that's what messenger RNA is. So it's a piece of genetic material. So
it's a completely new technique apparently, and I know Martin has something to say about this later. But how is it completely new? Why is this technique so new, and why are people really objecting to it more than they would to ordinary vaccines?
Well, it's new in the sense that it's a piece of genetic material. You know, people have been very cautious about eating GMO foods, for example, or tampering around. I mean, when you're dealing with genetic material, you're dealing with pieces of messenger RNA or pieces of DNA or pieces of RNA. All of these are pieces of genetic material. When you're tampering around with these sorts of things, you're tampering around with the very, very nuclear essence of what it is to be a living thing. You know, all living things are defined by the fact that they have DNA or genetic material. You know, so when we're injecting pieces of genetically modified or manufactured artificial RNA, when we're injecting that into our bodies and into our cells, the long-term effects of this type of carry on, if you will, are not really known. We really are kind of launching ourselves into very new territory. And a lot of doctors, a lot of scientists would feel that it's very, very dangerous territory, because it's a little bit like, for example, you can tinker about with the headlights of a car, or you can tinker about with perhaps the windscreen wipers, and you're not going to do too much damage. But if you're right in at the engine and the spark plugs, and you're right in at the internal combustion engine of that car, you're a hell of a lot more likely to do a lot more potential damage, long-term damage, than you might do otherwise. So I suppose, you know, that's probably the best analogy I could come up with, that we're right in at the heart of our cellular genetic makeup. So hopefully things will go right for the vast majority of people, but there are serious, genuine fears and concerns about how we're going about this, about the technology that's being used, and whether there will or will not be long-term side effects with this.
Yeah, but that to me is I now understand what. Well done. I now certainly understand better. We'll bring in Ellie here. Ellie, what's the situation for the medical staff and the patients in the hospitals you're in, since you're in the front line here?
To be honest, with the staff are very, very split or very, very divided about whether they take the vaccine or not. What I'm noticing is a lot of the staff that are probably late 30s plus are more anti-vaccine. The younger staff are more keen to take it, and I get a lot of messages now through Frontline Freedom of people saying, "How do I refuse the vaccine?" And I do always explain to people it's not mandatory as yet. You're very entitled to make your own decision and say no. And then I have clinical nurse managers that will also get on to me in Frontline Freedom, worried about their junior staff and how, they are actually concerned. How do I talk them out of having the vaccine? And I've said, you can't talk somebody out of having the vaccine. It's everybody's own choice. But they, and they're worried that, what about the side effects? And I said, we don't know what the side effects are. And the only thing I can conclude is that everybody has to go away and do their own research, because as a nurse, I can't promote the vaccine. I don't know enough about it. I don't think anybody knows enough about it. It's going to be terrifying in years to come. We don't know what side effects are going to come down the road. And another thing
what's the position where if a medical professional opts not to take the vaccine, are they going to lose their job, or what's the situation? Or on another question too, have you been given a time frame for when these vaccines have to be taken?
They're rolling out for the last couple of weeks. I have known quite a few staff who have refused, and there's been no issue as yet. They've just said they don't want it. Other staff are very, very happy to have it. Staff are getting worried that will we lose our jobs? And I know when the flu vaccine was being given out this year, there was a huge amount of pressure on staff to take the flu vaccine. And a lot of staff did not want the flu vaccine this year. And I also know with the children's nasal flu vaccine, there were a lot of push on that from the GPs and stuff. And I know majority of parents opted not to have the nasal flu vaccine for children as well.
So sorry. Go on. Sorry, Ellie. Go on out there,
just
Ellie.
in defence of Frontline Freedom, we are certainly not anti-vax. And I want to make that very, very clear. It's a brand new vaccine that's come off the market very, very quick. The trial basis wasn't large enough, in my opinion. We don't know the side effects. Some of the side effects I have seen are worrying. But it will be interesting to see a report when they do come out. And I'd also hope that the Irish government would actually report any adverse side effects, because I don't want them to be hidden.
So, could you compare, since you've been in the medical world for a long time, in this January and maybe in December, are you noticing any big difference in the attendance in the rate of viral illnesses in the hospitals you're in, or the hospitals you know of?
To be honest, I can't answer that question because I wouldn't see the COVID patients. But what I can alert you to is that diagnostic procedures are cut by at least 60%, and that is very, very worrying.
Could you explain that to people, what you mean by that?
For instance, somebody that needs a colonoscopy, the endoscopy units are probably they're not doing as much work as they can because of the COVID pathways. So a normal colonoscopy might take 30 minutes to do, maybe 45, but now you have a cleaning regime gone around regarding you have to clean the room before and after each patient, and you have to give the room time to breathe. So you're looking at an hour and a half procedure time for doing these procedures, whereas they could be only 30 minutes. So you have a knock-on effect that big cancer cases are probably still waiting to be seen.
Well, it's worrying, isn't it? It's worrying for anybody in the medical profession. What may the ultimate effects?
It is very worrying, especially with mental health as well. That I see it so much. People are very, very stressed. Um, Kids are just, they don't know what they're doing. Even when I get up in the morning, you're thinking, what is normal anymore? Nobody knows what normal is anymore. Uh, People, suicide rates have increased. Um, I just, I fear to think about how many cancers we'll see in a year's time or 2 years' time, and they could have been cured.
Right. So we'll now go to Martin, who can give us some insight into how the big pharma, well, what we call big pharma, but the pharmaceutical industry works. And maybe you could give us an insight into that, Martin.
Yeah, I think just in reference to what other people have just been saying, I would like to concur with what people have said. It seems as if focusing on the vaccine, first of all, is probably too narrow. I think we need to focus on, there's so many issues at stake here. And this is where I think it leads to confusion, and then people are living in constant fear. So for instance, you've got the lockdown, you've got all of these other component parts of it. So where does the science lie? Now, if it was a simple argument, if it was a simple debate, it may be one or two issues, but this is multifactorial. This is actually bringing in all aspects of humanity into the debate, and it makes it very, very difficult to deal with, because you're like, maybe there's 1,000 holes in a ship, and you're trying to block this hole and that hole, but there's so many holes, and that's where they've got you. Now, as far as the pharmaceutical industry is concerned, they're experts in the soundbite. They're not experts in the minutiae, they're experts in the soundbite. Whenever I used to go to see doctors like Dr. Marcus de Bruin in the north, we had 3 things to say. If we had 23 things to say, they would be too confused. What we left with a particular message, you got A, B, C, and what are you going to do about it, doctor? So it was very much using powers like of NLP or powers of persuasion. I mean, I don't know whether you've ever heard of a book by Robert Cialdini. It's called Influence, the Power of Persuasion. There's about 7 different qualities that you use to persuade people. And the pharmaceutical industry are masters of persuasion. I was involved in that ethos. I believed in it, but then I saw things over the years, and I started to question my own morality or my own understanding of how things should be. And at that stage, then I started to think, this isn't really my long-term career. I think I benefited from it for a period of time. But if you know the pharmaceutical industry, like for instance, I'll give you one example. Right now, what they're trying to do is deny things for you. Like for instance, things that we take for granted, like walking in the park or driving to Belfast. These are things you take for granted. But there's a thing in Robert Cialdini's book. He talks about one of the most is scarcity. If you make things scarce to people, they will put more value on that. Okay? So when people are, for instance, not getting to go to their discos or listening to their music or going out having a pint, these things are quite important for people. But what they do, they sort of say, I'll tell you what, see if you become good people. If you become the people, wear your masks, keep in over the next 6 weeks, we'll give you some more freedom. Or for instance, like Fauci just said today, I can see us maybe going to concerts in 9 months' time. If you're going to be good people, this is what I found that about 20 years ago, things changed with regards to pharmaceutical industry. First of all, doctors didn't want to see reps, or they stopped letting reps in to see them because they realized they're being manipulated to prescribe. So things started to change. Okay, so the pharmaceutical industry started to change their focus of how they could influence the medical profession. because individual practices started to close down and you couldn't get in to see them. Now, at the same time, as a pharmaceutical rep, I was asked to see 10 people a day, okay? 10 GPs a day or 10 consultants a day, whether I was working in hospitals, whether working in general practice. So the pressure was on me to see. All the other pressure that pharmaceutical people are put under is they have an annual appraisal, and you have to hit your sales targets by the end of the year, and you will get maybe a bonus in the January, for your Christmas holiday, or you could lose your job based on your sales performance. And every year you would have to go through. It was like an interrogation by the Gestapo. Okay, so we would be judged on our performance for our previous year, and on the basis of that, then you would get maybe 10% of your salary. So all the way through the year, you were really slugging it out to try and get to see people and try to influence people's prescribing. Now,
but the top, in other words, what you're really saying though is that top priority was not the health of the patients that those doctors would be seeing.
Well, first of all, from the rep's perspective, I tried to integrate that into it, but the bottom line, I had to get sales, and it was a sales driven, and I should have. So
That's
essentially,
sick. Most of us would think that was completely sick. Would you agree?
Well, I would say, first of all, everybody has got, like, this is another thing that happened as well. It coincided with that change. I don't know whether, Marcus, down the south, you experienced this, but up the north and in the British medical system, they brought out these things called the quality outcome frameworks, which basically they looked at things like cholesterol, heart disease, blood pressure, diabetes. And what they did, they gave GPs targets to reach. So for instance, 80% of their patients should get cholesterol at a particular level. Now, whenever you hit targets of that nature, it meant that those doctors had to be they were under duress to use medicines. Then after that,
and we know that's the whole statin thing is a bit of a minefield, which maybe when coronavirus is over we can discuss.
Well, I sold the statin, but the interesting thing is then that meant that the big companies like Merck, like Pfizer, they had a fight. They had a bun fight. In the north, whenever I started, there was two companies that were trying to fight against each other. It was Astra and Glaxo. They were the two. They both had respiratory and they both had ulcer disease. And we were the big, and as far as the north was concerned, the north was the biggest prescribing area in the whole of the UK for both ulcer disease and for respiratory disease. So West Belfast, for instance, BT 15, BT 12, 13, 14, 15, North and West Belfast is one of the highest deprivation areas in the whole of Europe. So you could think of people with ulcer disease and respiratory conditions. It was like a gold mine for pharmaceutical industry in those areas.
I mean, for instance, yeah, go on. Sorry, I'm horrified by what I'm hearing. Go on.
Like for instance, ulcer disease. We sold Zantac whenever I started. It was £1 million product for Northern Ireland alone. £1 million product, and this was like in 1989. £1 million in an area of just 1,000 GPs. Massive.
Person in the office getting people out, Martin, coming into you.
Well, I mean, I don't think it would come as a surprise to too many people to remind them that the major influence or the major ideology behind drug manufacturing and drug companies is not so much public welfare. It's turning a profit, and that's the number one kind of ideology and the number one point to business, to any business, is to staying alive financially, surviving financially, making a profit, getting bigger, growing. I mean, we live in a society that is, undoubtedly and decidedly capitalist, and these companies, drug manufacturers, have a capitalist agenda without a doubt, and everything that comes on top of that is really just frills and nice talk about helping people and doing good and everything else. But all of the good, nice talk on top of the drug companies might have to offer, it all falls apart if the bottom line isn't adhered to, and the bottom line is profit. And essentially, that's the very frightening thing about this vaccine and where we are today. I mean, vaccines in general, I've been vaccinating kids for the past 15 years. I've had all of my own children have been vaccinated. I have no particular issue with vaccines. In the history of human medicine, we vaccinate people, but we vaccinate specific people. We vaccinate people who are vulnerable to disease. For example, if you're going to travel abroad, you'll get travel vaccines. And you don't have those travel vaccines when you're living in Ireland, because you're not vulnerable to those diseases whilst you're living in Ireland. When you travel abroad, you're vulnerable to those diseases. They're there, so you get a vaccine. And that makes good sense. In the childhood immunization program here in Ireland, we vaccinate infants, we GPs vaccinate infants against diseases that lots of people, that all people can get. For one, for example, would be rotavirus or meningitis. You know, adults, for example, you or I don't get vaccinated against rotavirus, and we don't get vaccinated against meningitis. And the reason for that is that we're not vulnerable to that disease. For example, if you or I get rotavirus, we'll have a bad diarrhea, we'll maybe, you know, laid up with some tummy cramps for a day or two, but it's not going to kill us. So in contradiction to that, or in the opposite to that, in terms of newborn children or infants, if they get a bad case of rotavirus or they get a bad case of meningitis, that infant or that child could potentially die. So therefore, we categorize infants and children as being vulnerable, and we vaccinate them. And that's how medicine has always operated. It's been the basis of vaccination since Edward Jenner discovered the vaccine against smallpox, going back a couple of 100 years ago. But everything changed. Everything has changed with COVID-19. The narrative has entirely changed. We're talking now about vaccinating entire populations. Now, if you go on to, I have very little faith in what the official line that's coming from NEFIT and coming from the government, but I have a lot of faith in organizations like the Central Statistics Office, for example. These people are number crunchers. They don't have any particular axe to grind. They're not pushing any particular agenda, but the Central Statistics Office in Ireland runs our national census and collates all of the data in terms of our GDP, our financial data. They are the kind of the central, the gurus for statistics. But on the CSO website, in terms of COVID mortality, now bearing in mind what I said about vaccinating the vulnerable, if you go onto the CSO website and you look at the data that they publish for COVID-19, well, they've just finished, or last month in December, they published the data in terms of the age profile for people who have died from COVID-19. Now, it's very interesting, in the age bracket from 0 to 24 years, over the past year, so in the past 11 months, there has been 0 cases of death from COVID-19. Now, that's either death from COVID-19 or death with COVID-19 or death around COVID-19. Essentially, between the ages of 0 and 24 years, the CSO has recorded 0 deaths from or with COVID-19. Now, there has been 20,402 cases, confirmed cases of COVID-19 in that cohort, in that group. So if we take the people, all the people in Ireland of the age between 0 and 24, there have been 20,000 cases in that group and not one single death. So this is the first time, I think, in the history of human medicine where you have a very terrible disease that has, for example, infected 20,402 people, not one of whom have died, and yet the official line at the moment is that all of those people have to be masked up, locked down, and vaccinated. So we're in this very, very surreal situation where we're talking about vaccinating literally millions and millions of people who are of absolutely no risk from COVID-19. So this is a veritable jackpot for Pfizer, for the drug companies, for pharmaceutical bosses like Professor Luke O'Neill, who have been pushing this vaccine. In terms of in terms of the medical logic and the medicine behind it, there is no reasoning. This is the first time I've ever encountered in my medical career, and I think in the history of human medicine, where we're vaccinating people who don't need to be vaccinated. And I just finish off just by making one point, because the counter argument to what I'm saying is always people will come back and say, oh, but we have to vaccinate those children because they might spread the disease to the elderly, vulnerable people, because the CSO also tell us that 90% of COVID deaths, over 90% of COVID deaths, are in the age group above 65 years of age. So the counter argument to what I'm saying is always people will say, oh, we have to vaccinate healthy people so that they don't spread it to the vulnerable. But my point is why aren't we just vaccinating the vulnerable anyway? Because that's what medicine normally does. So we're in this very, very strange place where big business, big pharma, and big money industries are essentially dictating medical policy, medical practice, government policy, government practice. And it's a very, very frightening place to be, particularly frightening because so few GPs and so few doctors are willing to actually say anything against what's going on, you know.
Here's another thing for you, Marcus, but I want to ask Martin something about the pharmaceutical industry generally before I forget. But I've read quite a lot of, we've noticed that there's been a lot of deaths from elderly people who've been given the vaccination. And I've read an argument which says that the older you are, the less effective, because your immune system isn't functioning as well as it might when you're young, that in fact giving the vaccination to older people is a complete waste of time.
Well, look, in a general sense, the data that's come back, at least the data that I've read and the information that I've read in terms of the side effects with the vaccine is anywhere in the region of 4 to 5% of people vaccinated will suffer a side effect requiring some medical intervention or some sort of intervention. That data is pretty much confirmed across the board, anywhere between 3 to 5%. Now, that's not so bad when you're talking about vaccinating a vulnerable population, because remember, the very strange thing about Ireland is one of our great strengths is the fact that in terms of the vulnerable, which are those over 65 years of age, that accounts for over 90% of COVID mortality. In terms of that population, there's only 650,000 of those people in Ireland. So the age population in Ireland of over 65 is 650,000. And of that number, of the 650,000, there's an even smaller number who actually are unhealthy or have illnesses or diseases that would make them vulnerable to COVID. So we essentially have a very, very small population group. If we were just vaccinating them, then certainly the 3 to 5% side effect profile might be something that we could argue and say is kind of worthwhile or whatever for the greater good and all of that sort of thing. But when you expand the vaccine program, as has been done here, out into the realms of many, many millions, well, 3 to 5% of a million people is a hell of a lot more than what we would be seeing if we were vaccinating the vulnerable. And these are just short-term kind of effects. As Ellie pointed out there earlier, and she's quite correct, the long-term effects of what we're doing they won't be felt and may not be felt for many years to come. I was speaking with a colleague of mine tonight, Dr. Pat Morrissey, who you may know of, and Pat has been quite vocal as well in trying to bring some reason to all of this insanity. But Pat was telling me that we have to correctly refer to this vaccine not as a vaccine, but as gene therapy, because we are injecting a piece of genetic material into our bodies, which is entirely different from what we were talking about earlier on in terms of a little piece of protein or a piece of the outside of the cell. So this is definitely very, very scary stuff, and side effects and long-term effects are very worrying, you know.
Yeah, we'd like to say here that we have invited people who are pro-vaccine onto this program, and indeed anyone out there who's an opinion. This is the healthy debate. We're absolutely happy to debate all sides of the argument, but we got no offers on the pro-vaccine side of things. If we can get back to Martin briefly. Martin, I heard something about pharma, which was that Big Pharma has reached a point where it can't make money out of the old reliables anymore because they've become genetic, and so that something like a pandemic for them is as
generic.
You said before, generic. Excuse me. Yeah, that they've become generic, so that this has been, an absolute godsend for them. Would this be true, or is it a bit of an exaggeration? Where is pharma going?
Well, pharma have been talking about vaccines as the way forward for the last 15, 20 years. They realized that the just noticeable difference for each progression of a medicine category, for instance, the actual benefit is very, very negligible. And to put all of the research money into developing a new medicine costs a hell of a lot of money for very little in return. Now, whenever I was in the industry, we were talking about vaccines many, many years ago, and that's also coincidental to what's actually happening right now, because in the past, public health used to have a distance between itself and the pharmaceutical industry. But because of vaccination and the emphasis of vaccines, pharmaceutical industry have been basically entwined with public health. They are basically joined at the hip. And what I see, and the perfect evidence of that, is the selection of the top man in the UK to be Patrick Vallance, who has definitely got a conflict of interest. I would question that the actual association between public health in general and their association with the pharmaceutical industry. I always liked it in the past, whenever I was working as a bog standard rep carrying a case in to see GPs around the country, I liked the fact that if I was to get this general practitioner or this consultant to use my medicine, this was based on his decision. Generally, if you work on the basis of that, I tended to be more successful as a representative. But what I find now is that the pharmaceutical industry realizes that they can't have all the cake and eat it. So one way they did, because they were masters of public relations, and that's what I was saying earlier on about the fact that whenever I went in to see a doctor, I didn't tell them War and Peace. I had 3 things to say, and I wanted them to know. And whenever they were going, I was even going, can you think of a patient where this would work? Or that was the type of thing. So pharmaceutical industry very, very good at getting people to think at an emotional level, and that's how they connect. This is all an emotional. I would say this is emotional blackmail, and and when you've got the likes of Bill Gates behind it, and you've got all of these other organizations like the Great Reset. The thing about this whole situation with me is that, talk about even all areas of this, it's questionable. Every aspect of this is questionable. But the bottom line, I think, taking it away from vaccines, taking it away from healthcare, I'm a human being. I have a right to do what I want. What's actually at stake right now is that is coming under question. And we as people, we need to be responding to that, because, you know, my rights are not my privileges. Like, for instance, I was in Derry at the weekend. We walked along the Strand Road, and the police were following us because we were basically saying, you know, we want an alternative perspective. Walking down the road, and this is worse than the old days of the RUC.
On the street, were you protesting?
Yeah, we were just walking along saying, you know, there should be a new way of looking at this. And I think that's perfectly legitimate. Because we couldn't stand in groups, we decided we'd walk.
Oh, I see what you mean.
So they couldn't lift us. They couldn't lift us going down the Strand. I'm just walking down the Strand and basically giving leaflets to people. What's wrong with that? Now that is a crime in the eyes of the police and in the eyes of the government of Northern Ireland right now. Now, in the height of the Troubles, which I grew up, I remember going to school in Derry, and there's friggin' riots in the street, and we were living through that crap way back in the 1970s and 80s. And now what we're doing is, this is the weirdest thing, is the people in the north, we're actually, you know, I knew people that used to be out rioting all the time because they wanted a change of society. Mm-hmm. I didn't do any rioting. But the interesting thing is, what are they doing now? They're lying down and getting their bellies tickled by the government. Do you know what I mean? This is how ridiculous it is.
Oh, it's totally ridiculous. It's very hard for those of us who don't understand why it's going on. My own theory is to do with something. Maybe in pharma it's the same, that for all the scientists in pharma, you might have, I suspect, 10 management people for one scientist. That it's, what I find incredible is, and I don't know if Ellie could confirm this, in fact, I have a friend who works in, her job is to make sure that nurses are, agency nurses are distributed around hospitals in a sensible manner. So she works very hard and she loves her work. She knows every nurse in Dublin basically, but she has 3 people managing her, 3 people. And as she says, all they do is squabble with each other. And I have a feeling that maybe, I don't know if the 3 of you have any viewpoint on that, but I have a feeling that it's a problem of it's obviously a problem of micromanagement and overmanagement. But I don't know, in the pharmaceutical industry, I bet you there was more people doing PR and marketing than there were actually developing vaccines. Am I right?
No, actually, well, to be honest, the vast bulk of people that work in the pharmaceutical industry would be working in manufacturing. Right, that's okay. In the past. So yeah, the sales forces, but I have to say, this actually happened whenever I worked for one of the companies I worked for in the past. The doctor's surgery started closing, or they maybe only saw reps maybe 2 or 3 times a year. So what did the pharmaceutical companies do? They made more divisions. They used to, so at one stage I was working for Glaxo. Do you know how many divisions we had? We had about 6 divisions. And do you know what the nickname for Glaxo was? Naff Dog, not another fucking division of Glaxo. So what they do is they threw a rep at a problem.
Yeah.
Look, the pharmaceutical industry, they were making all the wrong moves with regards to accessing general practitioners or consultants. I ended up doing market access. My role for the last 5 years was trying to get areas to include my medicines in their formulary. And this is one thing that I also think it's changed with medicine, and I think it's a bit sad, because whenever I started out as a rep, I used to like the maverick doctors, the guys that actually thought for themselves. And whenever I look back, and when you think of it, this is the thing, science by consensus. What a load of balderdash. I mean, you look at somebody like Galileo, it wasn't science by consensus. He was going to get his head chopped off, and he was one man. This is the problem I find with science now. 97% of people say you should do this. Everybody should do it. It's done through, it's a form of gaslighting.
Yes. So we've just got a few minutes left, so maybe we could summarise what we've been talking about. Ellie, where do you think we'll be in, let's say, 3 months' time? How do you see it panning out in the hospitals and for medical staff?
I am hoping that staff will feel comfortable to make their own decision. But my real bugbear at the minute is informed consent. I don't feel people realise they're still having a vaccine that is under trial till 2023. And that seriously worries me. My own husband had his vaccine today and nothing was said to him about him having a trial vaccine. And also another thing that alarms me is I've been looking at the figures today for the death rates for Ireland for the last 6 years. 2015, we had 30,779 people die in Ireland. And I'll make this quick, I'll go right up to 2020. At the moment, at the end of December, we have 27,002 people have died. Like we're in the middle of a pandemic, we have had less people die. I'm not saying COVID is not there, COVID is there. It's a very serious disease. And another thing that really concerns me is we have the likes of India and Brazil rolling out drugs like ivermectin, doxycycline, zinc, and Dr. Pierre Corey has been in the Senate screaming for these drugs to be used, and they are known, ivermectin especially has been known to cut the COVID mortality rate by 80%.
And it's been ignored.
They're wondering, why are we not using them? You know, if somebody goes into hospital with COVID, why are we not using them? Why are we forcing this vaccine when our death rate is not incredibly high?
Well, Martin, maybe you'd have some final words on how the pharmaceutical industry works. Is it... We have to be careful we don't end up in court, I suppose. But I'll tell you what bewilders me. What bewilders me is that every January, without fail, the newspaper headlines are about the crisis in our hospitals, and I'm sure it's the same up north. And every year it fades away, because that's what viruses do. They come and they go. So I just don't understand why there's such a rush to get us all vaccinated up, when this will all be gone in about 3 weeks' time. Or sorry, let's say 6 weeks' time. Let's be pessimistic. So have you any notion? What's the solution? And you're going to Spain and you're doing other things anyway.
Well, first of all, I feel really sorry for the elderly people, because, you know, we're offloading the vaccines onto them. Like, there's a thing in medicine called quality adjusted life years, called QALYs. So the thing that I have to question about these studies, you can actually question these studies. First of all, the studies were not carried out in the elderly. I can guarantee you that. Those studies will be carried out on healthy individuals. And then you get the likes of the chairman coming out and saying they're 90% effective. What do you mean by effective? Are you talking about 1,000 people on a placebo, 1,000 people on the actual vaccine, and it's 90% effective on all 2,000? No, it's not going to be talking about that, because not everyone is going to get COVID out of that. You're going to get a minority of people. Now, what are we actually talking? Are we talking about people getting the flu? Are we talking about people getting symptoms? Are we talking about people developing antibodies? So this is the thing that pharmaceutical industry does, and I would actually question what actually happened at that time, because whenever I was working in the industry, it was frowned upon if pharmaceutical companies made announcements before they actually gained a product license. That was pre-marketing. You were actually pre-marketing a product before it was actually licensed. So he came out with this statement: these are 90% effective. We would not have been allowed to do that way back in the day. So what I would say is that you know, as far as the elderly people are concerned, you know, their quality of life. What's their quality of life at the moment? They're being concealed away from all the people they love. And I'll tell you what, see, if I was an old person, I'd be out dancing in the streets and doing my own thing. You know, what are we doing? Are we imprisoning the elderly people?
Well,
I mean, I want to have quality of life when I'm older.
I
And
think
I think it's sad. I mean, one of my friends, this is happening in England. She can't see her mother. Now, her mother's got Alzheimer's, and she goes in and helps her, but she can't touch her mother. Mother's behind the screen.
still behind it. Well, here you can't even go to them. I believe I was told that
Yeah. Look,
at the moment
so
behind the
so
screen.
I think there's an issue. Look, if you read that book by Robert Cialdini,
Yeah.
and you can actually look scarce. I've actually got an acronym. I'll send it to you that actually looks at all the 7 qualities. But all of those 7 qualities are being employed right now as an agenda to control us, to acquiesce. Sorry, I'm being passionate about this, but it has frustrated me for 12 months.
Well, I think we're all in the same boat. And Marcus, I think you probably have something to say about. I mean, I feel quite strongly. A friend of mine just told me about his mother, who's she's 87, and until this all hit, she was liable to take a tent and her sleeping bag and take the car up to Yorkshire. She's in England, and have herself a week away in the outback. And her son now is telling me that she's lost all her confidence, that she's physically not as fit as she was. I mean, and the elderly, I think you'd agree, are not being allowed to make decisions about their own lives. Exactly what Martin was saying.
Well, there's little doubt, Lindy, in my mind that the elderly have been a political and pharmaceutical pawn in this terrible tragedy, this terrible national and international tragedy for quite some time throughout the process. And it's probably not going to be today, tomorrow, or this month or next month when the real truth of what the elderly in nursing homes have suffered is going to come out, because all of that is clouded over or covered over by the mass hysteria at the moment. And you know, a lot of people consistently ask the question, kind of people like me. They say, well, why would the government be doing this? Because they have to lock down and they have families too. Why would they be doing this to themselves and doing this to us? You know, but my belief is that certainly what happened in Irish nursing homes was a travesty certainly a travesty of COVID, but mostly it was a travesty of political ineptitude and neglect. And that, you know, if we don't see, and we're presently not seeing evidence of the type of wave that we had in April of last year, part of the reason we won't see, and we're not seeing that wave in the nursing homes, should be a resounding signal to the few people who are awake in Ireland that the reason people are not dying to the extent that they were dying in the nursing homes in April is because, sadly, most of the most vulnerable in Irish nursing homes have been killed off, and they've been killed off by political ineptitude, by transferring live COVID cases into the nursing homes without testing those people, by withdrawing tests and withdrawing facilities so that they wouldn't run out for the general public, for people who didn't need them. So yes, without a shadow of a doubt, the elderly in Ireland are the victims. And since before COVID arrived in Ireland, the statistics and the facts told us right at the very outset of all of this that they were the people we were supposed to be protecting and looking after. And you know, you're absolutely right. Even up to this very day, in terms of their access to their family, in terms of being cared for, in terms of, you know, I mean, I was on this show not so long ago, and we heard from a woman who drove up from Kerry and had to stand outside in the rain and didn't even have access to toilet facilities while she was looking at her father through the double glazed window of a nursing home in the rain and cold. So without a doubt, the elderly are the victims in all of this, and it's very, very sad that they remain the victims in all of this. But I think it will be a long time before the hysteria dies down and people will actually begin to see that children are not the victims of this, don't need to be locked up and masked and vaccinated, that young, healthy adults don't, you know, it'll be a long time before people log on to the CSO website and read the facts, because what we've got to get rid of first is the hysteria and the fear. And most importantly, I think that's the reasoning behind politics as usual politics in Ireland today. It's to keep that hysteria going, because that's the smokescreen. That's the thing that hides the ineptitude, the incompetence, the cruelty, and the very, very, I mean, Martin touched off it there, this relationship, for example, between Valence in the UK, one of the leading advisors in terms of vaccines and COVID to the UK government. And the BMJ just published this week that this guy Valence has got 600, 800,000 pounds worth of shares in the drug company, or in the vaccine company, or the vaccine itself. So this horrible relationship between vaccine and pharmaceutical.
Hey, Marcus, I was wanting to ask you as well, Marcus. I was wanting to ask you, what do you think of your opinion in relation to Chris Whitty? For instance, he's like the nice old guy that's completely safe, isn't he? He's one of those guys that you say, he's like my old uncle, and I could go up to him and he'll always look after the situation. He's a safe pair of hands. It's nearly like a PR exercise in the choice of Chris Whitty.
Yeah. Yeah.
Right.
Well,
lads, we're going to have to wrap it up here. We could go on all night, and we had a fascinating discussion even before this all starts. So I'd like to thank you all very much, and as usual to let everyone know that this program is produced by a group of volunteers, and we have our producer Stephen. Sarah isn't here today, and we'd like to say a special thank you to Daniela, who has been helping us for the last few weeks and is off to new work in Philadelphia. So thank you very much, Daniela. And we'd like to repeat the appeal that we made earlier on for a space. If anyone has space where we can set up a studio, we'd love to hear from you. And also, of course, if you want to support us financially, the Irish Inquiry site is slightly down at the moment, but it will be back. And if you want to contribute to us in any way, you can get in touch with us via the Irish Inquiry Facebook. Thank you again. Thank you very much to our guests. It's been really good. And good night.
Thank you very much.
Good night, everyone.
Thank you. Bye-bye.
Thank you.